It basically said, how is all of this going to change? And let me do a couple of slides as we start thinking about the future. And one of it, and we've talked a bit about this already, is the whole idea of big data. There is a lot that we are going to be able to determine because of our ability to collect and analyze big data, to the point where clinical trials for new pharmaceuticals could be obviated in many ways because the data will be predictive. And I believe we say that here, that predictive modeling, and the newest, trendiest term is precision medicine, which is really increasingly saying customized to your DNA, to who you are, so that you don't end up getting a cocktail of oncology drugs, God forbid, that in the end is not right for you. And we will be able to know increasingly, and therefore saving money, especially as we age, as our population ages, because we will be able to far better analyze claims data, but more importantly, data out of electronic medical records, real data, not just data from claims. So the future of where data is going really is material. And for the universities that are developing specialties for their students in this area, I reinforce, because I think so much of our cost will be transformed as a result of the tremendous data that's out there and underutilized. So companies like Optum, that's owned by United Healthcare, are in this business. And every board I sit on, they all talk about how they want to get into this business, because it is, in many respects, the future. So predictive modeling, to be able to predict what's going to happen when you look at thousands and thousands and thousands of cases that have similar symptoms, and know with pretty good precision what you're going to need and how this is going to happen, is your future. And in our lifetimes, we will see this. It's already starting to happen. So, and this is a lot, it's also known, it's precision medicine, personalized medicine. So this is just an example. 40% of those diagnosed with depression are not helped by any medication. And being able to slice and dice the data to know that, to think about an alternative course of treatment, is what we ought to be doing so that people are not subjected to care. You know, hospitals in particular are very dangerous places. And you don't want to be there if you don't need to be. That's where people get infections. And so if we can bypass a lot of this because we know and can predict what's going to happen, I think if it were your parent or mine, that's what we would want to be able to do. And the mapping of the genome, we've all heard a lot about that, and we are just beginning to see what we are going to be able to reap from understanding this kind of science. And we will end one-size-fits-all medicine, which is really wonderful. It's not free. So, and then on devices and robotics, it will be the ultimate disruptor. I can't tell you how many people come to me with great ideas. There are more apps that are out there. There's more science that's going on in people's cellars and garage. There's tons of it. And what I tell most of them, though, is line up. When I was the CEO of a hospital, I can't tell you how many medical device people would line up at my door telling me why I should buy their tool, their app, their software, because they could save me money. And I used to say to them, you know, the pot of gold is this big. It's not this big. And you have to convince me why I should buy your product instead of your product, because we can't buy everything. So when I look at people who are into medical devices or software, the most important thing for them to understand is they have to prove it. They just can't say, I'll save you money, because that's not good enough. They have to prove it. Who's going to raise their hand and say, I'm not going to save you any money, but it's a good idea? It's just not going to happen. So people do need to understand that a device requires that they know how they can prove it and who's going to pay for it. because if they spend a lot of money, raise capital, and develop products, and then whoops, when they're ready to launch, they haven't got clearance on who's going to pay for it. And that's a real miss. If medical device companies don't bring on expertise early on to understand how this, do consumers want it? Do health plans want it? Do people want it enough to pay for it? So pretty important concept. Your smartphone, there are unbelievable implications for our smartphones. Where there's one company that I know of, if you keep your smartphone in your pocket, they are going to be able to tell whether you are adhering to your protocol for diabetes, just by keeping it in your pocket. They can tell by the cadence of your walk. They can tell by your breathing pattern. It's remarkable. So the punchline on all of this is the technology is moving faster than we are. And by the time we buy it, it will be outmoded. But it is exciting in terms of what is happening. And I would say for your children and your grandchildren, you won't recognize healthcare as it is today. And it will sound and feel pretty barbaric.